Good evening and welcome to IHW Council's special web show, Preserve the Uterus. During the show, we'll be discussing protecting women's health by preserving the uterus. I'm the host. My name is Anisha Nair, and this show is powered by Bayer. Now, after cesarean section, hysterectomy is the most commonly performed surgery among women globally. A hysterectomy is a surgery to remove the woman's uterus. This surgery may be recommended to women for different reasons, including uterine fibroids that cause pain or bleeding, uterine prolapse, maybe cancer of the uterus, cervix or ovaries, or any other serious health issues. But in many parts of India, women are undergoing hysterectomy on the ill advice of saving themselves from pain during menstrual cycle every month. In fact, in a survey conducted among 700,000 women between the ages of 15 and 49, the overall prevalence of hysterectomy stood at 3.2%, which is high compared to the global average. Is there an increasing trend of hysterectomy in India, especially in rural India? Is this a concern from the point of view of the health of the women? Does this have an impact on families' well-being as well as the financial status and the well-being of the family as a whole? These are some of the issues that we will be talking about during this show today. I have the privilege to welcome a very special guest. Please welcome Dr. Neelam Divakar Gore, Deputy Chairperson, Maharashtra Legislative Council, who will talk about the experiences she's seen in the state of Maharashtra. Thank you, ma'am. Welcome to the show. Now, hysterectomy should usually be the last resort and not the first one to ensure good health for women. What are you seeing? Are there misguided beliefs around this procedure in our country, especially in rural India?
Shall I speak?
Yes, ma'am. Please go ahead.
Yeah. First of all, I would like to thank the organizers, IHW, Integrated Health and Wellbeing Council. I would like to know from you whether I have got 5 minutes to talk.
Yes, ma'am. Please go ahead. Yes, ma'am. Please go ahead.
Yeah. So, I think I must mention here and acknowledge that I have been working in this area for a very long time, being an Ayurvedic medical doctor, and practiced in the remote parts of Marathwada, which is a underdeveloped area of Maharashtra state, where a woman was always equated with her status of her uterus. In the words, I remember when I practiced as a doctor, I remember women patients who told me that she has been made destitute by her husband because उसके बच्चेदानी निकल के गया है और वो औरत का काम नहीं दे सकती, इसके लिए आदमी ने दूसरी शादी कर दी. Because she is not able to give woman's duty, she is not able to perform woman's duty, her husband has married again. So this was the plight of many women who I met when I practiced in Marathwada. Now I will like to first of all appreciate the work which is done by IHW, which is regarding UN Global Agenda of a Holistic Approach to Social Development Goals and Continuous Learning Experience. And first time, at least in India, I come across this campaign where preserving uterus for better health can be seen, because I have read in feminist literature many times, and whereas there has been feminists who have always raised this issue of having factories of removal of uterus within medical system, which we call as hysterectomies. But we cannot look at being a medical practitioner and also social activist. I will not like to discard hysterectomy in toto, because I have also come across many women whose life has been saved, and under certain complications, hysterectomies do become essential. And secondly, along with that, when we came across the issue of sugarcane cutters in Bid district, and there was a news, I will like to read few points and recommendations what we came across. It was regarding in 2019, why women in Bid district of Maharashtra do not have uterine sac. There are more than 1 million women who migrate from Marathwada for labor, sugarcane cutters. They go from Marathwada to different parts of Maharashtra, different parts of India. And there was a calling attention move which was initiated by me. I was a legislator. I was not deputy chairperson by that time. Now that was in 2019 March session. And at that time, we raised this issue of high number of villages have women farmers, sugarcane cutters, where every woman has been done hysterectomy. And there are many women at the age of 19 or 25 when she's having 2 children. Then hysterectomy is done in some of the private hospitals. So there was a committee set up by government of Maharashtra, and I was made chairperson of that committee. And in the meanwhile, I became deputy chairperson of the state council. And after 55 years of independence, I was the first woman to become the deputy chairperson of this post. So what we tried to understand why these women, whether this is a occupational hazard, whether there is any other reason for this. And our main answer was regarding that it lies in the overall situation of their life. And there has been very poor infrastructure facilities, the situation where a woman cannot get employment as a single human being, but she has to have a male partner when she goes for migration for getting a job. And when they travel from villages after villages, they carry their children with them. And then they have to carry a bullock cart with, crossing 300 to 400 kilometers. And so many women said that while cutting the sugarcane, all the pressure comes on their womb. And at the time of menstruation, it becomes very difficult for them to bear that burden of bleeding when there are no sanitary napkins available, or whether there are also even toilets are not available. And many women we came across, we took discussion of women. I went to a village, we had a discussion with health officers, even with Gynecologic and Obstetrics Association. We had many meetings with including IMA and FOGSI, where Gynecological and Obstetric Association, we had discussion with them. So we gave certain direction to the labor department and also to the health department, where the private gynecologists should report their surgeries to the civil surgeon every month. That was one of the recommendations. Secondly, we came across also some women who told that they take money from the money lenders because the operations are not available for getting without charges. So they have to take loan from the Mukadams, and then they go across all these issues. Along with that, also at the early age, the removal of the uterus, if a woman is getting operated before at the age of 25, then we have made recommendation that they should be, they have to take permission from the civil surgeon, or at least they have to inform. There are recommendations after recommendations now in Beed district and certain districts of Maharashtra. Government of Maharashtra has tried to do some monitoring mechanisms, but still I will not like to say that it has stopped totally or it is going to stop. But the issue was that making health conditions better and having registration of the women laborers, keeping in this issue. Also, many activists shared with us that this is not only with sugarcane cutters, but it also happens in the middle class. It also happens in many women that after a certain age, women say that let me get rid of my uterus so that my life becomes more easy. Thirdly, there is, of course, there is big social trauma, social stigma that at the young age for menstruation also still the issue of our bodies, ourselves and our reproductive rights is not addressed properly, even by the policymakers and even in the society at large. So as a woman, I would say policymaker at a deciding stage or being the deputy chairperson, I gave directions to health department and labor department and human and child department to come out with certain measures. I'm not sure whether everything has been implemented, but I'm very happy. The current chief minister who came just now, he was the health minister at that time, and government of Maharashtra accepted this report totally to implement. Also, there has been a couple of meetings which has been taken by me. However, because of lack of time, I can't go into all the recommendation and every recommendation. But when I had word with the women and when I asked them whether if they get the labor charges as a single human resource person, instead of just getting tied up with her husband, they called it that koita. Full koita means husband and wife together, and half koita is only woman. So in this mind, women said that they will like to transfer the money to their accounts directly. So all these issues need more and more work at the local level. but the I would say initiative taken by your organization, Preserve the Uterus, is very important. So unnecessary operations of hysterectomies, whether they are cesarean, and also the issue is also of overall forced abortions, where without legal and medical precautions, we come across many women where girl fetuses are also being aborted, and the issue of PCPNDT Act is also there. So here I will like to stop for the time, but there are many issues which I still need to address. But I being the chairperson, I am supposed to monitor the time generally in this house. So I think that is your work now. So I will not like to take more time. Thank you so much.
Thank you, Dr. Neelam. And we will be talking more with you because we have a panel of experts who are joining us now to discuss this issue. Ma'am, just listening to you, we in urban India don't realize what women in rural India are going through. And actually, I'm feeling infuriated that a woman has to lose her organ because she doesn't have a sanitary napkin. There cannot be anything more unfair than this, hearing this. And I hope we find an easy solution to this. It doesn't sound very complicated. To give her some relief at the time of those special days in the month. In urban India, we're talking of menstrual leave. Maybe if not leave, just a little support for the woman would be very, very welcome. I would like to now, welcome our esteemed dignitaries. We'll be speaking about, we'll be speaking to medical specialists, to experts who debunk some of the myths that surround hysterectomy and what solutions are available to women for the issues that they are facing, so that this is not the first resort. Hysterectomy is not the first resort, and they have other options to relieve them of the issues that they are faced with. So please welcome our esteemed set of panel. We have Dr. Sadhna Tayade, Director of Directorate of Health Services, National Health Mission, Government of Maharashtra. She will soon joining us. We have Dr. Uttare Shiv Kumar Shankar, President, Maharashtra Medical Council. We also have Dr. Rishikesh Pai, President-elect, Federation of Obstetrics and Gynecology Societies of India and Medical Director, Bloom IVF Centers, and Mr. Manoj Saxena, Managing Director, Bayitis and South Asia Head, Pharma of Bayer. And of course, Dr. Neelam Devakar Gorde, Deputy Chairperson, Maharashtra Legislative Council, is also with us. Thank you all for joining us. Let me come to you, sir, to Dr. Shipmar. Now, Neelam ma'am has given us the example of beet, where this a special case of sugarcane farming, where, like ma'am said, that women are migrating for this period of 6 months where, cutting of sugarcane is happening. I want to understand from you, from the surgical point of view, how necessary is a hysterectomy in our country? The prevailing rates of hysterectomy in rural India, are they higher than what they were? What is really happening at a socioeconomic level in our country?
Yeah, thank you, ma'am, for inviting me and on such a important topic, and a topic which otherwise is not much discussed in the public domain. So that has been the problem. Basically, I would tell you of all this public education has not taken place as far as this issue of hysterectomy is concerned. There are two aspects to this. One is the social aspect, and the other thing is the medical aspect. Now, medically, it is, there are very, let me tell you, as far as surgery is concerned, any surgery is always a last resort. Only when the medical line, or if you're suffering from something and the medical line of treatment is not successful, only then we normally tell the patients to get a surgical treatment done. Of course, barring the emergencies which are there where we require to do the surgery immediately, those are different aspects. As far as the social aspect is concerned, what we have to understand now, since you have opened the topic of PED, because we were, as a council, we were also involved by the government at that time. And, when we were told about this problem which was there, which is happening in PED, basically because these workers, they thought that once they would be having their periods, number one, those 4 or 5 days, they were not being allowed to work in the fields. And these are daily wage earners. And the second thing is, in where, they don't have any avenues for birth control aspects to be followed. And if they get pregnant, then again it becomes a big hassle because they cannot work, because this is a physically tiring work which is there in the fields when they work. So these were the main two reasons why, they used to get this hysterectomies done. And as you said, 3.2%, if you are saying, is very high. One of the reports that we had got in the council was that in this bead area, amongst these type of women who are basically laborers, it was as high as almost 32% of hysterectomies done over there. Not only that, it was a standard thing that these surgeries, when it is not medically indicated, obviously they cannot get it done in a government institution where it is otherwise free of cost to get these surgeries done. So they had to go to a private institution, and to go into a private institution, the average cost was around 50,000, which again they used to be borrowing, as madam already said, from these contractors. And then that was a vicious cycle because they had to pay back the contractors by working in the fields. So this was the vicious cycle. Somewhere it had to be broken. I think government took a very wise decision at that time also, which was supported by the council, because we got feedback from our members in that area. How can someone question my clinical judgment of when I should do hysterectomies, when I should not do hysterectomy? You get all sorts of questions from even the medical fraternity. So we had to explain to them that if there is an indication, a medical indication for you to do hysterectomy, nobody is stopping you from doing hysterectomy. It is only that we want to control all these things, and even advisories were sent by the council at that time. Now, this is as far as, the labor class is concerned. The other class, the well-educated, well-to-do people, they feel that, the womb or the uterus is there only to bear children. And once they finish their 2 children or whatever their quota is, they feel it is a hassle every month where I have to, undergo these periods. And then some of them obviously have a little bit more pain and everything. And I find even in the high socio-economic strata, the women want to get rid of their uterus just because they don't want this hassle of, this monthly periods. Now that is also wrong. Let me tell you, this is not a simple surgery. This comes under the major surgeries also. And complications of any surgery, whatever you do, are there. So I am surprised why they want to subject themselves to a surgery which is not indicated, not warranted, and get all the complications done. This is on one part. Second part is definitely to our members also who are registered with us. We would say that unless it is warranted, they should also not encourage these women. There are other methods or other ways nowadays, especially with all these new medications, new IUCDs which have come to take care of this, basically DUBs or fibroids or whatever is concerned. I think they should first go in for all these, and only as a last resort go for a hysterectomy. So what we require to do basically is not only, putting in pressure on the medical community, that of course is required. But on the other hand, I think public education by the, institutions, by the organizations should also be there to try to tell these women what they are doing. Because see, it has been following from one generation to the other generation. So they feel this is the norm. This is not the norm. They should be told that this is not what ideally should be followed by all the women. And there are other avenues also available for them. So I think if we have this public education, it would go a long way in trying to stop these hysterectomies from being performed.
Right, sir. And this is our effort to talk about this, to start the dialogue going, because this is just no way to live. To get rid of an organ that God has blessed you, it's there for a reason. To make life easier, or presumed to make your life easier, perhaps is just a myth. Dr. Rishikesh Pai, we've understood the socioeconomic conditions or the reason why women are going for hysterectomy in rural India. Dr. Ture is saying that some middle-class women also want to go for this procedure electively because they don't want to suffer the pain of a menstrual cycle every month. But Dr. Rishikesh Pai, surgeries are drastic. What are the side effects of getting a hysterectomy done?
No, so basically, both of the previous two speakers have thrown a very good light on various social aspects of the whole problem. Basically, there are two main, our field of gynecology is very controversial because it deals with reproductive rights and everything, which we do, abortion or hysterectomy or cesarean, they are all controversial. And then ultimately, we'll have to, that's what we are evolving. So ours is the evolving kind of relationship with society and with government, the gynecologists, and we are creating algorithm. We are telling our members how to balance it out, how to use alternative methods of treatment rather than going for the drastic surgical removal of the uterus. So slowly it is evolving. Look at our country. It is our mortality rates are falling down. Everything is becoming better and better because our
Dr.
government,
Pai,
our
I understand you're
so
talking
I'm
from
just
the.
giving you the background of it basically. And so now coming to the complication rate of hysterectomy, obviously there are a lot of complications, but they are because of the modern day advances in medicine. The complications have become lesser and lesser as we are evolving our surgical skills, our backup, our post-operative. So sometimes you may have post-operative, injuries can be there to the bladder, to the bowel, but they are very rare. There can be bleeding sometimes following surgery. Sometimes there may be a decrease in the sexual drive. There is a, if you especially remove the ovaries as well along with the uterus, many times you do removal of the uterus as well as the ovaries, then that can reduce the hormonal and you may go into a kind of menopausal syndrome. And so there may be also psychological trauma which is there, that is involved in hysterectomy. So all these things are there, and of course once you remove the uterus you can't become pregnant again. So all these aspects of surgical complications are always there, but because the complication rates are now minimized because of so much advancement in surgery, that they are not that many. But obviously the psychological complications, the social issues which both the previous speakers have talked about are always there, and we have to try to tackle them in an effective way.
Right. Dr. Pai, could you tell us what are the alternatives or options for women available medically so that they don't have to go for hysterectomy?
Right.
Like
so,
say birth control or fibroids or painful periods. What are the options for women to avoid a hysterectomy?
So, basically I would like to juxtapose that in United States also, if you look at the indications of hysterectomy, the only 10% are needing definitive hysterectomy. When there is a, let's say, a problem of cancer is there, there is a chance that there may be cervical or uterine cancer. Obviously, you need to do a hysterectomy. But the other indications for hysterectomy are, there is there are tumors in the uterus that is called fibroids. Then there is a heavy menstrual blood loss which is there, that is called DUB or AUB nowadays they call it. Or there can be prolapse. Then the uterus moves downwards and comes out of the vagina. So these are, and of course there's a lot of people who may have pelvic pain as well. So endometriosis, but all these things now can be tackled 90, and of course cancer, if there is there, obviously you're going to remove the uterus, but the remaining 90% of these conditions can be tackled by other simple conservative manners. There are lot of medicines available now that can reduce the bleeding. You can have, as far as the fibroids are concerned, there's a new medicine for reducing the fibroid size also. Or you can have, we have got nowadays non-interventional techniques like embolization of the arteries that feed the fibroid, or you can use ultrasound waves and you can actually dissolve the fibroid. So those are there which are available to us. You can also remove the fibroid by laparoscopy. So you don't have to remove the uterus. You just go in and by laparoscopic surgery, you can remove the fibroids and retain the uterus. So as far as the bleeding, excessive bleeding is concerned, we have a lot of medicines available that can reduce the bleeding. We have got what is known as, you have that in the olden days we had the IUCD. There is a loop. So now this IUCD is loaded with a chemical progesterone which can act locally and reduce the bleeding. So there are lots of new alternatives that are available. There are the tranexamic acid is available. There are hormones. There are GnRH agonists. So lots and lots of there's a new development coming in the field called GnRH antagonist, oral antagonist. So with all these things, we can reduce the surgical intervention to a great extent in the future and presently as well. So the approach would be, yes, you have to counsel the patient well. You You have to try and offer them conservative management in the form of medicines, non-interventional techniques, and in a very small amount of proportion of people, you can actually give them surgery only. In fact, I was listening to Dr. Madam Gore, and I suddenly felt that one of the ideal things for these bead patients would be a depot injection. Depot progesterone is now available as a contraceptive, made available by our government. So every 2 months, if you give the depot injection, not only will it act as a contraceptive, but it also reduces the bleeding to a great extent. So that can be a very simple solution to the bead people's problems.
All right. Thank you, Dr. Pai, for giving us so many solutions that are straightforward, less complicated, and not invasive options for women. The only effort from our side is to try to increase the awareness about this, the availability of options, so that we can cut down on these elective hysterectomies that are taking place. Manoj, creating awareness and counseling is important. Dr. Pai has said that doctors should counsel their patients on these are the options available, go for this instead of this. But unless the patient also comes from some kind of standing of understanding, what it entails for her, what are the options available to her, how can she even seek the counseling? And do you think awareness here is very important? Because the lack of awareness is not just leading to maybe some sort of ill health later in life, but sheer exploitation of women. And people are, really taking advantage of this for their own personal profit. So here awareness becomes absolutely critical.
Yeah, absolutely, Anisha. I mean, we have seen what mass awareness can do, and we are all coming out. I believe we are coming out of the pandemic, and we know what mass media can achieve in terms of popularizing simple practices which can prevent COVID. Yeah, and for social problems like HMB or hysterectomies, and I'll take the discussion what Dr. Pai was saying. Right, in the clinic, we know a lot of the doctors, including doctors like Dr. Pai, look at how they communicate to their patients and giving them options, and then see what options works best for that. Depending upon the healthcare infrastructure, so it could be very different in Bombay to a smaller city or village in India. But more importantly, how do we also parallelly, because there is also a social aspect of it, create a conducive environment in the society and the community where the woman is living in, so that not just the women, but also the community where she is living in understands the impact of what hysterectomy can have. And I think in that, three things are very, very important for a successful public health initiative from an awareness perspective. One is having right partnership. And that is the reason why when Bayer started looking at it, we are partnered and we signed the MOU with Foxy, which is the most credible organization and the largest association for gynecologists in the globe. So Foxy is our knowledge partner, because credible information for awareness is absolutely important. Yeah, today you can go, people can go to Google and find out many things, but I think the credible information is important. The second is, how do we communicate that, right? So using simple language, lucid language, vernacular language, so that people understand what does it mean and how they can deal with that. Yeah. And third is, how do we create a scenario where a woman who needs some help can reach out to the healthcare practitioner. Yeah. And so I guess that's also is important in that. And mass media, social media, all are playing an important role, because today when you look at a number of people who have internet access in India is over 650 million. Yeah. So using social media, but also using local media channels, could be mass media, but could be other medias are important, along with the partnerships with the organizations like Foxy, particularly because they have the domain expertise and knowledge, and also understands the local fabric of their patient or their women, in that vicinity. So that could definitely help us to amplify the message and communicate in a manner where a woman feels empowered to take a right choice for her, and not just feels that whatever is being told by her employer or brother or whatever is the right thing to do.
Right. Dr. Neelam, I wanted to understand from you. You had given us the example of bead. And Dr. Uttare also spoke about asking medical practitioners to report the cases of hysterectomy. Now, why is this necessary? Does the medical side also need to introspect here? And what has been the impact of this, this communication? That please report the number of hysterectomies you're doing in private hospitals.
Anisha ji, here I am also myself from the medical fraternity, so I don't like to criticize on anybody, but we came across cases after cases where we could observe that there are certain agents which have been appointed, or some of the doctors are friendly with them maybe, so that women are taken from villages by a rickshaw or a jeep for getting operated to a particular doctor. In one of the districts, we came across Dr. Pai. Only one specific hospital had a very large number. So I tried to do a fair deal that maybe he or she was very popular doctor. But if there is also outsourcing, so if they are supposed to be answerable to the lead civil surgeon, then they may refer the cases to their friends in nearby districts. So all the number of hysterectomy may be increasing. Number one. Number two, what means the reason? Basically, I won't say all the doctors are something very commercial or anything like that. But what happens is that even the patient is also of the mindset that if Dr. Pai says that I will not operate you because you can be given another medicine, she may think that she has to take very strong medicine, bhari kuch to do. So bhari, this is something very big operation. So that also gives that, because she has seen another role model where a woman, and then all the women were complaining, Anisha, that they are having backache, they are having pain, and then they would say that because I don't have uterus, now I am sick for the whole life. Now, I think there is need for counseling, what we are speaking, and along with that, there is a need to have a very huge awareness program within women, not only related with hysterectomy, but overall, keeping them safe and secure. Then it can be I would say this is like anemia, or it can be safe motherhood, or even building up toilets near every PHC or bus stand, where we may say that because all the young girls I came across, they say that we don't have place to put the menstrual cloth, even which can be dried. So all these things needs to go hand in hand, Anisha. It cannot be only medical fraternity. It has to be with the Jilla Parishad. It has to have chemists. It must have components like social workers, even journalists. Also, cases after cases in some districts are seen. In the 6th or 7th pregnancy, a woman dies. And then with other 5 girls or 6 daughters, the man is trying to get married again. And people are trying to collect money for him so that he can pay and do. I said that instead of seeing your wife getting traveling towards death, if he had saved her life, that would have been better. So, everything cannot be done by the government. But here, I'm very pleased to see Mr. Saxena from Bayer. So, if there are more stakeholders coming ahead, and there can be more interactive forums for even doctors, some more, even chemists, who now Dr. Pai said about injection, contraceptive injection. But there can be small side effects of such injections also. So if women are not explained what can be those side effects, then it just moves like a panic. They say, isse to marta hai, isse to dardar hota hai, isse to ye hota hai. Or when I practiced, that time, you must be also experiencing Dr. Utture and Dr. Pai, who are practicing doctors. If Sadhana Tade was here, sometimes I feel it is also psychosomatic sometimes, because I came across some women who said that because not we are allowed to go out of the home, and I am allowed to go out of home if I am going to temple, or if I am going to vegetable market, or if I am going to doctor. So without any pain also I am coming to you and taking medicines. That also some of the patients are there. So it becomes psychosomatic. Of course, it was before 15, 20 years. But now also we came across women that there is still lot of issues in our mind which are not answered by the society and by the system. And men are also so ignorant about all this. So we should not consider that only women need orientation and training. Because when husband supports her decision or husband insists, then she thinks that, okay, if he is saying okay, that must be right. So we have to, if we see the overall situation, and definitely there is some commercialization. I will thank the insurance industry not to give insurance for hysterectomies in Maharashtra. Because in other states, we came across cases that because women are getting compensation from insurance, every women were getting hysterectomies done, villages after villages. So also we have to look into the line. And also it does not mean that we should try to just stigmatize hysterectomy. Your main focus in the protecting women's health, then there can be component like menopause also. There can be component of hysterectomy. Also, when we're thinking about options, there was a suggestion by our health secretary, Dr. Pradeep Vyas, and he said that there are some of the instruments which have come up, which can be used if in certain conditions we can avoid hysterectomies. So even government was thinking to give these, I think there are bangles or some instruments which can be help for women. So even government was thinking to buy them so that that can be distributed properly and it can be used in proper conditions. But all this needs one comprehensive perspective. Number two, involvement of the society along with the local government officers. Everything talking to ministers is good, that's okay. But when it comes to implementation, the most of the things are implemented by the civil servants in the district. Number two. Number three, there has to be perception which needs to be created in the society. Because Anisha ji, in Bid district, there was a hospital found out before 10 years, still that case is going on, the doctor has been punished. There where we were able to get fetuses after fetuses of girl fetuses, Dr. Munde's case. Same thing has been repeated in Wardha, where 43 girl child fetuses were found in a septic tank. So here we have to deal with also medical termination of Pregnancy Act, where there are new amendments where they are supposed, they can do abortion even after 4 months or 5 months. But only thing, what is the medical condition that needs to be understood and that needs to be endorsed. So all these committees are being set up. I took meeting with the health minister and home minister, where police have to understand what is medical termination pregnancy act. It is very difficult for them. They can't understand many laws related with health. So there is need for working together. And I think if we provide some forums, which this one workshop should not be end in itself. If we want to carry it forward, Stri Aadhar Kendra, the NGO through which I have been working, and there are also many other NGOs connected with this work. Even in Bid district, there are many civil society members who will like to able to take forward. And here I would like to conclude with one point that even sugar factories, some of the sugar factories have come forward. They said that we'll build up toilets forever in our area so that the women doesn't have to suffer. And Mr. Gaikwad, who is the sugar ayukta, Sakhar ayukta, he is the Shekhar Gaikwad. Mr. Shekhar Gaikwad, who was previous collector. So sometime if he is there also, he has tried meetings after meetings, and government has come out with 3 GRs, 2 from labor department, 1 from sugar ayukta for all the sugar factories. But this needs to be taken at the national level. Only state will not happen because many migrant laborers go to Karnataka or Andhra or Orissa, and even same things must be happening in Uttar Pradesh and other parts of the Gujarat where these migrant laborers are facing all these type of issues. So let us not concentrate only on one sector. Basically, women from unorganized sector and women from different strata of the life, they need this campaign. And we need to involve people at different levels. And we must have some focus of how we'll be able to take this forward, even at the intellectual level also. Thank you.
Right. Very rightly said, Dr. Neelam. This is not just the responsibility of the medical industry. That they will treat, they will counsel, they will do everything. We all have a stake in this. So, Manoj, what can we do? This is our effort from IHW's Council. Let's start talking about it. Let's at least create an awareness. that there are options and you don't need to go for hysterectomy because you need to be employed, you need to be fit to be working. There are other things you can do. But as a company, as a corporate, as schools, NGOs, what can be done on a ground level so that, women know about this, they are aware about this. So when they go to their doctor to discuss this, they come with some information.
Yeah, no, thanks, Anisha. Look, Bayer has been present as a pioneer in the women's health business for last 9 decades. Yeah, I think we felt that being one of the stakeholders, and I think Dr. Neelam was also saying that, not just as there are many stakeholders in this, right? Not just as a pharma company, but also across the board, government, non-government, society at large, of the gynecologist community, the healthcare communities, pharmacists, and everyone. But as one of the important stakeholders, a lot of gynecologists and with our working closely with them on this topic of HMB have been pushing us to do a little bit more. Yeah, and I think courtesy that we have now are doing this program, which is a nationwide campaign, and not just for Maharashtra, Dr. Neelam. So what we are trying to achieve in this Preserve the Uterus is 3 things. The first is what can we do to essentially build capacity. Yeah, and when I say capacity is upskilling HCPs, doing programs along with Foxy as the knowledge partner to communicate the most advanced way of managing HMB, managing and avoiding hysterectomies. The second is building awareness through communities. And I think IHW Council is also helping a lot in building that awareness among communities so that they understand and take an informed decision. Yeah, and also from topics like women's health, sometimes it's difficult for a woman because if you look around, most of the pharmacists in India are male. So even we have now a Facebook Messenger, which is a chat bot where on topics like family planning, a woman can privately use a chat bot and understand what and get little bit more awareness. So building awareness in the community and doing a lot so that people understand what is hysterectomy, what is HMB, what can be done, what are the options which are available, go to the right set of doctors to get the right advice. And the third is building partnerships. Yeah. So of course, this Preserve the Uterus is in partnership with Foxy. We also have a strategic partner in IHW, but also bringing in other stakeholders who can play a critical role, whether it is at the state government level, but also private other partners who can really help to communicate and build this. Yeah, so I know a lot of other corporates are interested in it. I think what example of Dr. Shekhar Gaikwad, who what Dr. Neelam just said, could be also one of the partners in this who can help to bring us closer and bring more hands together to really communicate well among the community. So building partnership is also essentially 3 things we are looking at doing this. We have already reached out to 3,800 gynecologists in India in partnership with Foxy. So upscaling that, building awareness among communities and building partnerships so that we can take this Preserve the Uterus, which I think Dr. Shiv Kumar started with, that no one is talking about hysterectomy so much, right? So having more partnership would help us to have a larger voice on this front.
Right. Dr. Ture, I want to ask you one thing. Dr. Neelam spoke about what she's seeing on the ground, and she gave an example of a woman who was left destitute by her husband because, she had a uterus removed. Her husband said, "Your work as a woman is over." So, when it comes to things like hysterectomy, there are these reproductive rights that come in. But in our country, do women really have these rights? And to think that, okay, the woman will decide, women will have a choice post-counseling. How realistic is it? And how do you involve families, communities, so that, the choice is actually a choice and an informed one?
Yeah, basically, I think socially, if you see, we are, though we are improving day by day, definitely in India, but still it is a male-dominated community, unfortunately. Uh, and what happens over here is, other than the medical field, in the other fields, the males are never taught about, or there is no program for them to learn about these things, by which they can partner with their wives, or at least try to tell them what is the right, what is the wrong thing, everything. So that is the unfortunate part, because that education is not there. That's why I was also insisting that basically what you require to do is to educate the masses as far as these things are concerned. This is the social aspect. The other aspect is the monetary aspect also, you have to understand. The non-surgical treatments which are there, those are long-term treatments. They require a lot of expenditure also to be done over there, whereas the hysterectomy seems to be a one-time expenditure. That is how, the society also looks at it. And that also plays a big role. And therefore, if you say women have the choice, they don't have the choice, it is very, 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 very difficult in our society to, expect the woman immediately to, like in Western countries, to say, yes, this is my body, I decide what to do. Even today, if she wants to get an MTP done, or she wants to get a tubal ligation done, she has to get the signature of her husband on paper. And another aspect is, as you said, this false psychological aspect, and this is not only in women. I'll tell you, even in males, we are trying to promote so much of vasectomy to be done instead of, tubectomy. And vasectomy is less than 5% requirements as far as tubectomy is concerned, very safe surgery. But that male feels that once he gets the vasectomy done, he is going to lose his man. And the same thing happens in a female also. Psychologically, once you remove the uterus, even if the ovaries are left behind, uterus, the work of the uterus is only, to have babies, and this, it does not have any hormonal aspect. Those are in the ovaries. So without the uterus, there is not much harm as far as the hormonal aspect is concerned. Yet, if you see psychologically, the woman goes down so much, thinking that she's lost her womanhood. She's of no use to society, to her family, to her husband. That is a wrong sense that is there in her mind. And again, this all requires a lot of efforts, not only from the medical fraternity, from the government side, the administrative side, to educate the masses as far as these aspects. And let me tell you, in Indian society, now it is happening in schools and everything. But during our time, I still remember, it was a taboo to discuss all these, sexual aspects which are there, even menstrual aspects which are there. Nothing used to be discussed in the schools or colleges, though now it has started. So maybe down the line, we may see a little bit of improvement in all this. We may see the empowerment of the woman to decide what she wants to do, what she doesn't want to do. But as of today, we are still a little bit way behind as far as that aspect is concerned.
Right. Dr. Sadhna has also joined us, Dr. Sadhna Dayade. Ma'am, we've been discussing the rising trend of hysterectomies especially in Maharashtra and some of the other rural areas in our country. Now, one of the things that is coming out is, the lack of facilities and poor sanitation and hygiene is one of the major reasons for women to opt for hysterectomy. So, in this area, what is the government doing to ensure there's better sanitation and menstrual hygiene, especially in the rural areas? Dr. Sadhna, I would request you to please unmute yourself.
Am I audible, madam?
Yes, ma'am. Please go ahead.
Yes. I joined a little late, was busy in some meeting, some other meeting. So the question is regarding the sanitation and the menstrual hygiene and all these things. Let me tell you that, yes, the percentage of these premature hysterectomies has increased in Maharashtra, and NFHS 4-5 that has also shown the increasing trend. Regarding this menstrual hygiene, or what Dr. Utturu has mentioned about the education of the masses. So regarding that, we already have a program in Maharashtra which is running, that is the Adolescent Healthcare Program. And through this program, all our ashas, now you all know that the ashas are catering to the population of 1000 in a sub-center area. So through this program, we trained the ashas, we trained our ANMs, those who are posted at the sub-center level. And recently, health wellness clinics are also established at sub-center level. The sub-centers are catering to the population of 5000. So each sub-center, we in Maharashtra, we have one BMS doctor now. So all these people, they are trained for this ASH program. And through this ASH program, we are counseling to the adolescent population for menstrual hygiene, one thing. Then for the behavioral changes that we are telling them, we are telling them about the menstruation and the care to be taken during this time and what will be the changes during this period. That also we are taking. Moreover, madam, we do have a RBSK program in Maharashtra and which caters to the population from 0 to 18 years. So these two programs, they are catering to the adolescent population as well as to the young adults. After that, this 15 to 49 years of age females, they are throughout their reproductive age group. That population is scattered by all the gynecologists, the ANA, and again the PSC medical officer. And through this program, we are educating them regarding this. And recently, since last 3 to 4 years, the non-communicable disease program is also implemented in Maharashtra. And through this program, we are educating every female after 30 years of age to come to the sub-center for the routine checkup yearly. And that is not for only the reproductive problems, but it is for any other problem like diabetes, hypertension, any other problem she has. So there are various programs which are running in the Maharashtra, and through these programs, we are trying to educate these people. But at the same time, I would like to tell you is that the government is not sufficient. Only government is not sufficient to educate all these masses. At the same time, we require the other organizations also and the NGO participation to educate the people. Even we do have the village health and sanitation nutrition these visits or the teams available at all villages. So in the rural part, we are trying to educate more and more people. We are trying to bring them under the care of all these services and trying to give them as far as possible the knowledge about all these things. But still, I would like to tell you is that it's a bad part, and it's also sad that the premature hysterectomies are going up. And most of the studies, they are also showing that they are more seen in a females, uneducated females, the migratory workers, like in Bid district, where it was seen in sugarcane factories, the workers who are going for the sugarcane factories.
Yes, Dr. Satha, we discussed that. So the question I had from you was, you spoke about the awareness programs and using ANMs and ASHA workers to get the message through. But what about the physical infrastructure of having, toilets, or distributing the sanitary napkins? While we are seeing private companies set up toilets, etc., but their upkeep to change behavior on a community level, you need work. So, what infrastructure work is being done by the government?
Yeah, regarding infrastructure, also most of the houses, they are having their own water source. Now, through this family health survey, we do have a survey done with the help of these ashas, and it is seen that 60 to 70% of people, they do have their in rural area. I would like to tell you is that it is quite improved. But in remote places like in Nandurbar districts or in Meghat area, there is a problem of this. And this water and sanitation department is taking care regarding this.
Right. Dr. Pai, one question to you. Do you think regular cervical cancer screening and cancer screening of other ailments will also help reduce the incidence of hysterectomy?
You have asked me the question, madam. I can't.
Yes, Dr. Pai, the question is for you. Do you think screening for cervix cancer will also reduce the cases of hysterectomy?
Yeah. So no, so basically, first I would like to say that the Maharashtra government, see now all the three people are there. Dr. Gore is there, Dr. Taide is there, Dr. Uture. The government of Maharashtra is very advanced in its approach to healthcare, and it's really made a fantastic difference. In fact, I keep on telling that in a lot of the private, patients come to private practitioners, but they don't get as much benefit that they get in a government institute nowadays. The infrastructure, the way they have developed the infrastructure, the way they are approaching the problem. Many people tell me that people prefer going to government colleges to deliver nowadays. The fringe people who would go to private or public. So it's a fantastic. I must really appreciate what they have done, and also appreciate the Bayer for doing so much great work. Now, as far as the cancer screening program is concerned, so I would like to tell you, madam, that I am, as incoming president of the federation, I am planning to have an integrated program, because every agenda is you need to integrate everything into 10 minutes. My plan is to give the information in 10 minutes of right from beginning, from the birth to the end, that is menopause, cancer. Within 10 minutes, people should be educated about what is there, what are their rights, what are the tests that they should do at different times of their life, etc., etc. And that is what I feel the same thing they will be incorporated. My program it's called the Badlav program. It is known as Change program, and this Badlav program is consisting of immunization, adult education, bleeding, contraception, sexual health services, cancer screening, HPV screening. The WHO has now come out with HPV. You don't even need to do pap smear. There is a new advocacy that you can just do the HPV screening, and if HPV is positive, you can immunize the patient. If it is negative. So these are all these things that can be done very aggressively and integrated way, not only in public-private partnership, but there are basically two Indias are there. One is the poor India, which is very important for us. Nearly 1 billion people are still not very well off, and they need to be taken care of. And we all feel that for our federation, and now we have been governed by the NMC, which is the new organization of the government. All of us feel that the doctors should be selfless, and they should do selfless work. I believe they're doing free work for these 1 billion people, and the remaining 300 million, which are the middle class of our country, we can charge them reasonably. So all these populations need to be covered by preventive health programs as well as by curative programs, as Dr. Sadhna madam was telling us. I'm really happy that things are going in the right way. Our developmental goals are improving, and as Dr. Gore has made me realize that it's not an easy solution. There are different aspects to it, and not everything will fit one solution.
Right. We've come a lot of ground on the ideas that are there to help increase awareness about this and to make a real social change, a real lasting change at the ground level. We have corporates who are doing their bits, a 3-step action plan that Manoj spoke about. We've got government agencies. Dr. Sadhna spoke about how they are getting the message across with ASHAs and ANMs. So at the close of this discussion, Dr. Neelam, still with us, ma'am. What would be your biggest takeaways from all that you've heard today?
Have you asked me?
Yes, ma'am.
Yeah. Thank you so much for giving me an opportunity again. I try to be very hopeful because the times and so many changes which happen in our economic system and democratic setup, especially with the women getting reservation at the grassroots democracy, things are changing very fast. So I feel that they can become advocates. They can become one of the leaders who can take this forward. And there is definitely hope for this. And keeping this in mind, if there are many other stakeholders, as Mr. Saxena has said, I think along with the government, the different civil society mechanisms can make this goal true. It may take long time because already yesterday there was a gender parity report which says that we may take 132 years to reach to that stage where women and men will be having equal rights. However, though we can definitely see in the last 3 decades, there has been many changes and women have come forward and having better participation in many sectors like tourism, banking, even in technology, medical field, and also researchers, scientists. Government has given also 1/3 reservation. So keeping this in mind, we have to be aware about the tycoons and the agents who do organized crime of making these things more and more commercialized. So here, all the people who are well connected and people who have got good intentions of having good health, if we try to come together, definitely this makes difference. And taking all the context of sustainable development goals, we can definitely think of taking it forward. And I will be happy to give you whatever support and power I am having as a legislator to take this issue forward. Thanks for inviting me, and thanks for meeting you all.
Thank you, ma'am. Dr. Neelam, for your offer of support. I'm sure we take it up. We've already heard Manoj talk about Buyer's Plan, and all hands are needed, ma'am. All support is welcome. Thank you so much. And I'd like to thank all our speakers for joining us today and sharing with us their thoughts, their views on this very important issue of the rising cases of hysterectomy in our country. Dr. Satnas Dayade, Dr. Shiv Kumar Shankar, Dr. Neelam Divakar Gore, Dr. Rishikesh Pai, Mr. Manoj Saxena, thank you all for joining us and sharing with us your views on this very important issue. We hope that the message gets through, more awareness is created, and women get the power to decide what they want to do with their bodies with the agreements of their families and their husbands and the communities. Thank you so much for joining us. We'll wrap up the show now. Do follow ISW Council's Facebook page to get updated on all that concerns your health and well-being. This program was supported by Paya. We'll wrap up here. Goodbye. Take care.
Thank you so much.